Welcome to Body Best Doctors. We have a patient here. His name's Trey. Originally from Canada, came down to California. He's also a videographer and photographer himself. So he's going to be seeing how we do with this film. He's never seen a doctor of chiropractic before. This is his first time. So he's a newbie, and that's good, and I like that. So we're at Body Best Doctors, and we're going to do a little interview. He's filled out his symptom survey about some of the boo-boos that he does have. He's quite an active boy and has been his whole life. So he's got some knee and some elbow and some other issues. So we're just going to start with the examination as we would do with any new patient. And you're going to hopefully learn lots of things about your body and what chiropractors really do. Body Best Doctors is a franchise worldwide, and we teach doctors around the world. Let's get started.
All right.
I'll start. The first thing that we do at Body Best Doctors is the science behind balance. We have here behind me a digital postural analysis, which is 2 digital scales that I'm going to have Trey stand up on, 1 foot on each side. In about 9 seconds, it'll tell us his exact weight on each side of his body, and then I'll tell you what that shows us on Trey today. Go ahead and step up, turn around, face out the front door. First look down and get your feet symmetrical on each scale, both feet a little further apart. Perfect. Now look straight ahead, spot yourself out the door or at the corner of the poster there, and your eyes are part of your balance system. And that's why when you close our eyes, we can lose our balance. So we should be within 0, perfectly balanced, up to 5 pounds is normal. And so when it locks, we'll have the photographer take a picture, and he is 13 pounds heavier on the left. Normal, again, like I said, is 0 to 5. So I call this, he's jacked up. Okay, we're gonna do a physical exam on Trey. First, we have him lay face up on a flat table. I touch his feet. We see if the heels are lined up, and we can get a picture of this. He doesn't know this, but his right leg appears to be shorter than the left because he's twisted out of balance. You will also see before he's done, he will be perfectly balanced here on the table and on the scales. Okay, we're gonna do some muscle response tests. Trey, let the left leg go out. Hold the leg out. I'm going to push in, and you do not let me. Ready and hold. He is very, very strong. Now I want you to take your index finger, and we'll have you touch the TMJ joint, which is the little dip right there. First finger.
Oh, sorry.
That's your TMJ. In the sport of boxing, a pop on the chin jams those 2 joints, unconscious, on the floor, knocked out cold. So this is the balance system, so I'm checking his balance first on the scales and now on the table. So now hold this out again, just as you did. Ready, hold. Okay, relax the finger. You can put it down here now. Both arms above your head, palms face each other. Come straight up. Now I'm measuring Trey's balance at his neck. And his right middle finger is longer than his left, and that's the whole twist that we just talked about in the heels and the hips and all the way to the shoulders and the head. So we're going to get him balanced, okay? Now I'm going to touch the base of Trey's head. I take my palms, ring finger basically, come in the side of the neck, slide up to the base of his skull, and the right side of his skull is sitting off to the right, completely off balance. So that's also what we found: scales, leg length difference, shoulders and arms, and now his head's not on straight. And we're going to get your head on straight. We're now going to do a spinal examination. He's laying face down so I can get to his spine. We're going to do 5 lumbar vertebrae I'm going to touch, 12 thoracic vertebrae in the rib cage, and 7 cervical in the neck. So we touch first the sacroiliac joints, the hips that carry all the weight when we walk. Firm pressure on the right, firm pressure on the left. Does it feel different or the same?
Sorry, you're asking me if the
Good.
pressure feels
Yeah. Right side compared to the left side feels different or the same. It doesn't need to be a whole bunch. It's just perceived different.
Yeah, it feels a little bit different. It feels like It feels like this one, my right side.
So his right side is more sensitive, which
Yeah.
is where he carries all of the weight when he steps on his right leg. And so that joint carries it back and forth, and that's what gives us the wiggle to our walk. So here's another example of one side of the body compared to the other, the main joints in the lower back, lower hips, that's sensitive or tender on the right side because he's carrying his weight more on that right side. Now we're gonna do 5 lumbars. I'm gonna take my thumb, I'm gonna press firmly. I'll do 5 and then I'll stop and then we'll do the thoracic and then we'll do the neck. Lumbar number 5, compare that to number 4, number 3, number 2, and number 1. Different or the same?
Definitely different.
Okay. 5, 4, 3, 2, 1. All of them? Which ones? Want to do it again?
Yeah. 5 is
5,
definitely the
it's-
most pressure, I feel.
It's the number 1 disabling condition in the world. Number 4,
A little bit less than 5.
3,
That one's a little better.
2,
And 2 is a little more pressure.
1.
2 and 1 are a little more pressure.
Okay. So his lower back is quite sensitive, which is not uncommon. Now we're going to go where the thoracic cage is. That's the rib cage. There's 12. I'll go from 12 to 7 in the center, then I'll stop, and then we'll go from 6 to 1. Number 12, compare that to 11, 10, 9, 8, and 7. Different or the same?
These ones were more of the same. But
Okay,
I think
good.
I felt it a
That's
little more
good.
at the top. Yeah.
Number 6, number 5, number 4, number 3, number 2, and number 1. Different or the same?
Mostly the same, except for 3 felt a little bit different.
Which one?
Number 3.
T3. Thank you. That goes to the lungs. Now number 7 in the neck, 7 compared to 6, compared to 5, 4, 3, and 2. 7 to 2, different or the same?
5 and 4 are a little bit different.
5 and 4 cervicals.
A little more pressure, yeah.
Now we're going to come up to the top of the spine, and I can only check it on the side with the transverse process that stick out on each side. Cervical vertebrae number 1 will press on the left, and we'll have him compare that to pressure on the right. Different or the same?
A little bit different on the left, I'm feeling a bit more.
So now we've analyzed his total entire spine that balances him against gravity, and we find some problems that we're going to fix today. So, with the first correction, I rechecked Trey after he didn't pass the balance test, and his head did not stay on balance, which is not uncommon. It's the leader of the gang, and it has to be perfect. And this has been an active boy, and he's knocked that head off balance, and it didn't correct with the instrument. So now we flip him over onto his stomach, and we're going to adjust it by hand. So first we place the blocks, because the tailbone, the sacrum, and the head pump mechanically the cerebrospinal fluid around the brain and spinal cord every 7 seconds. And that's why people get headaches and don't feel good and don't sleep good. So let's put this block underneath the right hip low, and this one high. Then I check the heels to make sure I have the blocks placed correctly. And his heels are perfect, so that's the position. Now, we're going to adjust the occipital bone. This is the head sitting on top of the spine. Trey's laying like this. I'm going to have him turn, he's laying, face down like this. We're going to have him turn his head to the right, and I'm going to adjust this like white part of the bone here, his head on top of his neck. Then we'll put him back on the scales, and he should be balanced perfectly. All right, turn your head to the right. Both hands can probably go comfortably off the table. Now, let me find him under here. Go ahead and raise your head up off the table. I'm going to take my forearm underneath the chin down here and lay back down. That's it right there. So the base of the skull, the occiput is here, and it sits on 2 joints, one on the right and one on the left, and we're going to adjust from the right to the left. So I take my forearm behind the ear, nice and comfortable. We do a little stretch to make sure it feels okay. And then we have him take a big deep breath. And when he lets the air out, his body's relaxed, and we set it. There it is. Now look straight down. Is that pretty wild or what? Now, back on the scales, Trey. So when we have an occipit or the head out of balance, it affects the hip balance, and those are the two centers of balance in the body, the head balancing over the hips, and then the head and hips balanced over the feet. So a lot of doctors, chiropractors, put people on their side and roll the spine, adjusting the lower back, the two strongest joints and the biggest vertebrae in the body. It's not supposed to be that way. They're secondary to the problem in his head and his pelvis. So we use two wedges, and we're going to put one under his left hip and one under his left foot, and we're going to put them opposite each other, and one high and one low. So this one's going to go low underneath his ischium, his sit down butt bone down, and his ilium that holds his pants up. And they're at an oblique opposite each other. I come and make sure I look at the heels, that they're balanced with the blocks. That means I have them placed correctly and they're balanced. Now we're going to go to the head. Turn your head to the left. I take my two fingers, chin up just a little bit. I take my two fingers, touch his base of his skull, the instrument on my finger so it's very gentle, and 3 clicks with respiration. Breathe in and out, and that's it. Now we look straight up. We take the blocks out. Go to roll on either side, Trey, and stand up and walk around and lay back down, face up. This is your test ride. When we adjust patients lying, 90% of the brain turns off when we lay down, so we can go to sleep. When it stands up, that 90% comes back on and we got 100%. So when I make a correction to a patient's spine, like Trey, we just did, now I have him retested after he stands up and lays back down again, face up. We check all of our balance points again. The heels for the hips are still balanced from the mid-back first adjustment. And now we're going to test the neck itself and then the head. Arms above your head, all the way up. And now his neck is perfectly balanced because his fingers are balanced. And now I'll check the head. Again, slide underneath the base of the skull with my ring finger, come up. And his set perfectly. Sometimes it doesn't, and then I would demonstrate a hand adjustment to the head and recheck it. But he's now balanced. So I didn't check the diaphragm earlier, and it's the most important muscle in the body. So I'm going to have Trey put his hands right here below his rib cage, both hands, and have him take a big deep breath. Let it all out. Okay, and another deep breath. So his diaphragm is working perfectly. When he breathes in, the diaphragm pulls down and the stomach automatically rises. So his diaphragm is working. So now, put your hands down. What we're going to do is a little palpation. So the first correction to Trey's spine is we're going to basically do a standing, what we call anterior to posterior, front to back, and you'll see me actually lift him with my legs. And I treat some big patients, and I was a professional ski racer, and I could press 600 pounds with my legs, so I'm not going to have a problem adjusting Trey today or any of the patients that I have, even though how big they are. So I'm going to have you put his left hand on top of his right shoulder, his right arm underneath around to his other shoulder. I'm going to use these arms to basically lift him. And I'm going to put my hand behind his spine right where we found the stress in the middle of his back. Bend slightly forward. And we're going to make a correction to his spine. Take a big deep breath, let it all out, weight onto me forward. There it is. Amazing, huh? Wow. Now, the noise is just nitrous gas, just simply like popping the finger. It sometimes makes noise, sometimes doesn't. Now, back onto the table, face up again. Okay. Ready? So, we've made the first adjustment to his mid-back, the strongest area in the body. Now I'm gonna recheck his leg length and his arm balance to see if that corrected it now, or we're gonna continue to make sure it's corrected if it's not. So we take and look at his feet. His heels are now perfectly balanced. We come back up to the arms, hands over your head, palms face each other. And it is also balanced. Now, since that's the center of the spine, it changed his whole balance. Now, one thing that most doctors don't know how to do is find the head out of balance, called the occipital bone, and then how to correct it properly. So again, I'm going to put my fingers underneath the base of his skull and see if his head got on balance, and his head is still off balance. It's kind of a independent little deal here with his head, so we're going to make an adjustment there. We're going to first use an instrument adjustment. If it doesn't make the correction, then I'll do a hand adjustment, and it's just versatility for doctors when people are sometimes afraid of the chiropractor and having their bones pop. It's usually not a problem, but anyway. This is called a double-headed activator that has two little prongs that stick out. Usually it's just one. This is a special instrument that was passed on to me from one of my trainers that's now not around. He's moved on to other spheres, and I'll show you how this works. It's called the Activator, and it's a spring-loaded, and it adjusts faster than humanly possible, is its fame to claim. So, turn your head to the left. I put my two fingers, so now we're going to use the instrument to communicate the diaphragm to the intercostal muscles in between the ribs that also assist with raising the chest, and Trey's chest doesn't rise. So I'm going to use, we can't really reach the diaphragm, so I'm going to come underneath the base of the rib cage on the right. Just come up underneath. We're going to do 3 little clicks. Breathe in and out, and over a little here. Breathe in and out. Then we're going to go to the left part of the diaphragm. Breathe in and out. And over here, breathe in and out. Now we'll see if that made any difference. Hand onto the stomach, hand onto the chest, big deep breath. Okay, still it's moving a little bit, but not as much as it should. Hands down. Now, we have 12 ribs, and they come from the back, and they come around to the front to what we call our sternum or our breastbone. I'm going to do a friction release on the joints in the front here. So it's just like this. It's about maybe 5 pounds of pressure, and we go up and down the sternum, right where the ribs attach to the sternum, and for some reason they're not communicating. Okay, now, hand on the stomach, hand on the chest, another deep breath. Let it all out. Breathe in again. Now his chest is starting to rise. Okay, now hands down. Final issue, he's had an injury to his knee on the left. So I'm going to do an examination to his knee to see if there's any ligament damage, which would basically be a surgical condition, and I don't think that's it, but I'm just demonstrating for you and what the body best doctors are trained to do and find. Go ahead and bend this knee up. This is called the drawer sign, just like opening a drawer and closing the drawer. I'm going to come with my hands behind in his calf, and we're going to do a little traction and see if it stays solid or if it moves. And you can see it if it's a problem, and I'll show you for up closer up. So we're going to do a little traction here, here, here. Now put this one down and we can feel the difference, one knee compared to the other. Bend this one up, and we'll traction here. And so they're both moving the same. There's no cruciate ligaments inside the knee that have been damaged that would be causing knee problems later on. Both legs down. Now the other ligaments in the knee is what we call the medial meniscus, which is on the inside of the knee, and the medial collateral muscle here on the inside of the knee and the lateral collateral muscle here. So that's tested also. First I'll check the medial. I put my hand on the outside of the knee and do a little testing the strength of the joint. And it moves normally, and if it was a problem, it moves way more, and the ligaments has been torn on the medial side, which is the most common with knee injuries. Now we'll switch the other side of the knee, and we test the lateral ligament and see if there's any play in here. And his knee is okay as far as ligaments. He just strained it. Now the next part of this particular treatment for the diaphragm is the esophagus. What obviously we swallow food, comes down, passes through a small hole in the diaphragm to the stomach. So I'm gonna put my fingers underneath the breastbone, and we're gonna do what we call a soft tissue adjustment, which you'll see is just a quick reflex down to see if we can make sure there's no interference with the diaphragm and the esophagus right here. Take a big deep breath, let it all out. There it is. Now, hands back on the stomach, hands on the chest, breathe in again. Wow! Did you feel how deep that breath was?
Yeah. Yeah.
That you have only been breathing half, I'm telling you, that's amazing. So now we've got this released, the diaphragm, and it's working perfectly as it should, pulling down and filling those lungs. Now, let's go back on the scales and see if that makes a difference. When we check Trey's diaphragm, the diaphragm pulls down and the stomach comes up. Well, after the stomach starts coming up, that's pulling the lungs, filling the lungs with oxygen. Then the chest rises too. Watch when we do this again. One hand here, other hand up here. I want you to, you've already seen this come up. See if this hand comes up. Trey, go ahead and take a big deep breath. This does not move. So we're gonna go ahead and fix that. Put your hands down on the scales again to check the balance, one side compared to the other. Again, it takes about 7 seconds to get the reading. It's locked at 82 on the right. It was 80 on the left. Now we're back to 5 pounds, which is the maximum for being balanced. And it was going back and forth as it went from side to side, and it was actually 2 pounds at one time. And in time, his body, because we just reset it, it will be more used to the balance, and he'll balance more perfectly in follow-up treatments. Okay, now we're going to do what we call our nutrition examination, and I'm going to test the 3 most important organs in the body. We're going to check the liver, which is the biggest and most important organ in the body, the spleen, which is on the other side, which is the second largest organ in the body, and then his pancreas underneath. The liver receives all the food from our colon, and it analyzes things, and the liver is responsible for sending those nutrients to the entire body. So any liver problems can cause many other problems. The spleen is where the white blood cells that go around and beat up the bad kids, they hang out in the spleen until they're called upon, and then they go out and do their job in taking bacteria and viruses and things in the blood system and saying, you're out of here now. The pancreas is basically what produces insulin and controls our blood sugar. So if somebody's putting too many carbohydrates and sugars into their body, they'll burn out their pancreas, and that's called diabetes. So we can check it to see if it's all in good shape. Okay, we'll check the liver first. Bend this knee up. So again, a muscle response test. The muscle that I'm testing ties into the liver. Trey, raise your leg up straight to the level of the knee. Hold the leg up. Do not let me push it down. 1, 2, 3, hold. Liver says it's happy. Bend this one. Spleen on the other side, same test. Raise the leg up, down to the level of the knee, right there. Ready and hold. Ready and hold. There it is. Okay. Now legs flat. So that's the spleen. Now we're gonna test the pancreas. It's the latissimus dorsi muscle from the shoulders that ties into our pancreas here. Turn your palms out, thumbs down. Hold both elbows into your side. Do not let me bring them away from your body. Ready? Resist. Okay. So his liver, spleen, and pancreas are working perfectly. In interview with Trey, he does Muay Thai. And what that is using your legs, your feet, so to speak, and your arms and your hands for kicking and punching. So he's been hit in the jaw, and his jaw is not the problem, but the jaw was being stressed because it had been hit, and he was also off balance, and the jaw is our gyroscope. That's why a certain punch onto the jaw jams these two joints simultaneously. Bam! They are out cold on the floor, knocked out. So he's been hit, but he's never been knocked out per se, but he's been, we'll call, beat up. And so we tested the jaw, and how we test it is you take your ring fingers, slide them inside the external canal here for the ear, and I put the jaw, if I push forward and have him open and close his jaw, I can feel his left jaw clicks when he, both of them click. This jaw has been taking too many punches, and it's now clicking and popping and telling us it's not as happy as it could be. So the actual meniscus, which is the cushion that the jaw joint rides on, when he opens his jaw, the jaw comes slightly forward and then back, forward and back. When he opens his jaw, click, close, click, back and forth, click, click. So in time, I would predict that when we keep his head balanced, his hips balanced, and his neck balanced, the clicking will probably reduce significantly, if hopefully not going away in time. Just tell the patient here, I'm gonna press on his leg about the same pressure that I'm gonna put on the colon so he'll understand. So it's a firm pressure, but it's not gonna cause any pain, but it's a good firm pressure. I've got a good 8-10 pounds. So now I just take either hand and just use my basically 3 fingers, come down to where the colon begins, where the appendix is. And we put firm pressure. We start gently and just very slowly go down to that pressure, and you tell me if it gets uncomfortable. Now we come up the ascending colon towards the liver underneath the rib cage. Then it turns.
A little uncomfortable there.
Little uncomfortable there. The colon comes across, called the transverse colon, and turns here at the spleen. We'll do another test here.
Yeah.
And it's tender. And then we'll go down the descending colon to the bottom where it turns and then goes out.
Right towards the bottom.
So we found tenderness in his colon. So that means it's possibly inflamed, and we're gonna do more of the nutrition analysis as we go along, and we're gonna actually discover what foods are causing that problem, and then we'll be able to tell Trey why his colon is tender and how to fix it. In our nutrition part of the examination, we're gonna now check Trey's gut, specifically the large intestine. The large intestine starts where it delivers its food. The small intestine delivers food to the large intestine, and we go up the ascending colon toward the liver. We're gonna feel across the transverse colon to the other side of the rib cage, and then down, and then it comes its last turn here and out. So I'm gonna put fairly firm pressure, not to cause any pain, but enough pressure on the colon. If it's not happy, the colon will feel uncomfortable, and Trey or the patient will tell me that doesn't feel good or it even hurts. So here we go. This is the first spot. So this is called pH paper, potential hydrogen, tests where the body is too alkaline or too acidic, which it's usually more acidic, and that's determined by the types of food that are alkaline or acid that we're eating. So we tear off a piece of the litmus paper called hydronium paper. Then I'm gonna ask Trey to give me some of his spit, and it's this easy. What you're gonna do is make a spitball on your tongue, and then you're gonna hold this, I'll give it to you, and then you just simply touch it on the spitball, no lips, turn it over, touch it again, you're done, and give it back to me. Right hand, there you go, make your spitball. So this is pH, potential hydrogen, whether he's too alkaline or too acid.
So touch it here.
Yep, perfect. Yep, you got it. Perfect. So then notice that it changes color. And then on the little strip here, you can get this at your standard drugstore, we match his color to the color on the stick. That's 2 green there on the paper. That's still 2 green. I think it's a 6.2 pH, which is fairly acidic, but it can even be no color at all, which is really acidic. So what this means is we'll be teaching you on the nutrition how to put more alkaline foods into your diet so your pH will come back more normal. When it gets too acidic, it tends to dissolve the bones, joints. We start having different kinds of pains and aches because the pH is controlled in the body by the biggest mineral in the body, which is calcium. And so if we get too acidic, the body goes to the calcium, to the bones and says, give me some of that calcium, I need more alkalinity to the body. And pretty soon that causes bone problems and joint problems. And it's just coming from a diet that somebody hasn't been taught how to keep their pH balanced. And you can buy this paper, like I said, and you can check yourself. You don't want to check it every day, but you can check it once a week. Want to start over?
Go ahead.
Is 128/85 and pulse at 95. The actual blood pressure is actually in normal ranges, and, I'm sorry. Standing blood pressure, it's 130/75, pulse is 63. Now, next we're doing the orthostatic hypotension standing blood pressure. So we turn the instrument back on, and then I'm gonna bring his hand, which is the monitor height, up to his heart. Don't have to touch it. So now we're checking his blood pressure standing. The blood pressure should go up. His systolic blood pressure, the high number, the first number, should go up 8 to 10 points to be perfect. So we'll see. And standing, what we've learned from the lying and standing blood pressure, again called orthostatic hypotension, his blood pressure went up 2 points, which is supposed to go up maybe a little bit more. I don't know, Trey maybe didn't get his rest last night. I'm teasing. And he didn't. And then his pulse went up 7 points, which is good. When you stand up, your heart speeds up and it beats a little bit harder. And so that shows that he's okay, but not necessarily perfect, but he's gonna pass the test. Next, we're gonna check what we call orthostatic hypotension. It's a fancy name for a lying and a standing blood pressure. There's 3 ways to take blood pressure: lying, sitting, and standing. We're just gonna skip the sitting. So this is the new cuff. Notice how small it is compared to the cuffs you've probably seen. It goes around the upper arm. This goes around the wrist. So we always take blood pressure on the left side because the first artery that leaves the heart goes down the left arm. That's why sometimes when people have a heart attack, specifically men, not so much women, they have pain down the left arm. So we're gonna go ahead and put this on the wrist, on his left arm. The next test is to test his thyroid. Instead of doing a blood test, we're gonna actually do the thermometer test, and the hottest area on the outside of the body is the armpit. So instead of doing the temperature in the mouth, we're gonna do the temperature in his armpit. So let me turn it on. We're gonna go to the left side. This little thermometer, I'm gonna slide it underneath the sleeve, turn it on. Here we go. And close it down. Takes about 9 seconds for the thermometer to give us a reading. And there's actually a range that's on our cards that they'll be in, and I'll tell you where his thyroid is, whether it's high, low, or normal. Also, we're gonna take a look at the thermometer. The temperature is 96.5. It's a little low. So what is the best remedy? The basic was discovered in 1850 is Dr. Augustine Lugol, and he made a solution of potassium iodide and iodine. And it's a liquid solution, and patients take approximately 15 drops a day. It actually then feeds the thyroid. It feeds actually all 10 trillion cells, and is the minerals that are essential is the iodine to run his entire body. And that's the remedy we'll be recommending for Trey. So the Zyto scan has been done. Trey's all finished. So this is what it looks like. It just gives you a visual representation of, we'll call it a happy cell here with green, and they're having a party and everybody's happy. Now we've got some red ones around here that didn't get to join the party, and they're on the outside and they're not feeling too happy. So in concept, it's going to tell us where in his body might not be working as good as it should be, and the actual nutrients that support those systems are maybe a little deficient. So then it's going to recommend what he can do, and you'll see the results. So there's the first picture. Here it is in a smaller version. So what it is you have 51 out of balance, and that's the red. So it says, okay, how can we fix these? So it scans the products all in there against your body. First one is a Medi-Herbs Cranberry Complex, and it changes 44 of the reds. So notice here and here, it's like, wow, that looks a little bit better. And then it keeps going, and Medi-Herbs again is a digest phytosynergist, which is part of his digestive system that breaks foods down so his body can absorb it. And that it basically put it back down to 4. And then finally it gets to Thyroid Complex, and his range is down to 1. And that's pretty much the complete thing, 3 different things. So his thyroid is going to get some nutrients to help his thyroid that controls all 10 trillion cells. And in his digestive tract, there's more cells inside our digestive tract than in our bloodstream. It's just amazing how many we have. So that's the initial. It actually goes and talks about the different nutrients that is recommended. And this first one, which is Cranberry Complex, encourage healthy urinary tract function, which is his kidneys and bladder, support healthy bladder function, and mucus surfaces in the urinary tract. Okay. The Medi-Herbs Digest Synergist stimulates gastric juice output and appetite, support healthy digestion and intestinal function, promote healthy gastrointestinal tone, which is the actual flexibility of the gut and how it moves food through our body, and healthy intestinal flora, which is there's more good bacteria in our gut than there is cells in our body, helps cleanse the liver, the biggest organ in the body. And we did check Trey's liver, and it's functioning okay, but this is a finer tuning that shows it can assist some help. And then the Thyroid Complex, obviously the thyroid itself controls all 10 trillion cells in the body and keeps them burning at 98.6, and everybody's happy. Here it goes into 12 of the main organs, and it shows here, this would be balanced at the red line that goes down here. And then, so this would be a little bit low. This would be, if it's down here, this is even the lowest one is actually the lungs. And so actually the lowest one is actually the prostate. And so as a male, that can be a problem in the future. And that's the lowest. And then the next one is his lungs, and then his kidneys. And we'll be explaining to him how he can assist in a normal natural nutrition program that I'll be giving to him also. So that just gives us an idea of which organs are happy and which are not. Just for a positive, there's your pineal gland, which is basically, have ESP. You can look into the future. It's amazing. So that's one of your gifts. You're attuned to the universe through your head. It's amazing. Now, the urinary bladder is the highest in the red, And so I'm just gonna say that he probably is not drinking enough good spring water, okay? So that system says, I want some good water to help dilute things and also eliminate things that are not good. This is the spine, and it's another whole system here. And we did the spine here, and it would tie into these different areas on palpation when we pressed on his spine where the nerves are. So it coincides with that, which is nice for me to review. It gets into areas that's way beyond most people's understanding, that the teeth are related to our organs. So when a tooth has a problem, that is the source of what's actually causing the organ problem. And the dentists, as we know, they're just trained to drill and feel and pull the teeth. They don't want them to know all this stuff because it gets too complex for the dental industry and everybody else. So here it tells all his teeth. So I tell patients, if you've been to the dentist, you can go ahead and ask for the chart that they charted the teeth and found out where the problems be. They take some x-rays and things like that. So you kind of got something to correlate with. Oh, that's the one that he saw that has a problem, or that has a filling in it, or that had to have a cap, or that had to have a crown. Well, it doesn't fix anything. You gotta go fix the organs. And so this helps you take it beyond that. Here's the traditional meridians, which are basically 12 of them that are the energies in the body. It shows his governing vessel, which runs from the lower lip to his pubic bone in the front of his body, is stressed. And then the one that's, let's find the, we're gonna do a brain dominance analysis on Trey here. And so you'll just see how it's done. We're checking the function and of his brain, right and left. People don't realize they actually have two brains, so one on the right side and one on the left side, and one is dominant over the other side. Then they can get what we call switched, and they're using the subdominant and become less efficient in certain things. So we'll go ahead and do the test, and then I can explain it in more detail. So the first thing we'll check is Trey's eye dominance, near point and far point. We have both. When we're reading, we're looking at a board or a movie or a TV. So we'll first check his near point. So we have a card with a dot and a card with a hole. So I'm gonna have Trey hold it in one in each hand, this one underneath with the dot and the hole. So then he's gonna look through the hole to the dot, and then he's gonna bring the dot card up to his eye, never losing sight of the dot, okay? Each hand, line them up, bring the card up and never lose sight of the dot. Okay, here's our genius. You don't understand what he is? He's left-eyed, and I believe you're right-handed. Okay, so there's a switch. We're gonna go over that. Now, stay right there facing, that's near point, like looking at the book. Face me this way. So just a good distance. Oh, stay right there. Point at my finger. Okay. Whoops, that is interesting. Point again. Okay. He went to close his left eye. He's left eye dominant, short and long. And that doesn't mean anything to you at this point, but it will when I start explaining it. Now, earlier, that his diaphragm was not working properly and he wasn't breathing properly, and that's where the diaphragm lets the esophagus pass through the diaphragm comfortably, hopefully, and into the stomach, and he had physical stress there. He doesn't have a stupid stomach. His body's he's basically a very active boy, and he's got his system knocked off balance, and that diaphragm says, I gotta help this kid. And so it contracts to help balance his spine, but it's now stressing his stomach. So he can't digest the food as well as he could. So there's a good correlation between our physical exam and the nutritional exam. And then it just goes into extra services that are possibly done. Now we're gonna go over what the doctor here is gonna recommend for nutrition, showing people there's foods that actually cause inflammation and cause stress. And we say, I don't want that if it's causing stress in my body. I like the taste, but this goes in. And so this Body Best Doctor's healthy foods in the right side, meaning the right thing to do, is the healthy foods. It's two-sided, so again, on the right side is the healthy foods. Obviously, we have, so we can educate people, foods that are unhealthy and list on both sides. So I get kind of real here with the patients, is just say, I can't follow you around and kick your butt if you don't eat the right kind of foods, but I know that you would like to feel healthier and have more energy. And so this is actually the ticket right here. So it might take some time to take those foods that you love that are killing you and say, I don't want to do that. I'm going to replace them with other ones that you can learn to like. So this is a very comprehensive nutritional analysis, and then it's also backed up by the Zyto that you just did, and you can obviously do that at any time here at the office, and there is your list. Congratulations. Can you answer the phone? Listen to it.
Okay.
He's not playing the game. You gonna go to your left or right?
That would definitely, because, okay, when I
Yep.
get my phone,
Yep.
when I actually get my phone, I pull it out of my
Yep.
pocket
Left.
with my left, and then I put it into my right hand.
Okay. So we should be writing this down, but anyway, we can remember it. So you're right, you're left-eyed, and you're right-eared. So there's a mix there. You should be right-eared and right-eyed. Now what, you write with your right hand, throw with your right hand. What, do you do anything specifically with your left hand?
Play the piano on the bass side.
Is
with
that
my
okay?
left
That's
hand.
okay.
I don't know.
Okay, stand up and hop on one foot.
Hop on one foot?
Hop on one foot. Okay, he's right-footed. Okay. Okay, we've taken you to a physical exam and a basic nutritional exam, and actually we checked your brain. So, in generally, as far as feeling and as far as balance, do you notice any feeling difference, or would you like to make any comment to people that might want to know what it's like to come to the Body Best Doctors?
Yeah, I definitely feel different. I felt like a little lightheaded when I stood up from the table, for sure. And after he adjusted my neck, especially, and my back, when we heard the nice snap, crackle pops, there was definitely a difference in like the way that I could feel and like the way that my body was moving. And even my jaw is starting to feel a little bit different as well, with like the clicking and stuff. But yeah, it's a very refreshing feeling, actually, and it's things that are subtle that you don't usually notice throughout your life, because you kind of push them in the back of your head because you experience them so much. But once you feel the difference, like, you know, it's all these things that you've already felt that had changed.
Great, thank you so much. It was a pleasure meeting
Yeah.
you.
Oh, it's a pleasure coming through. It was awesome.
Great. So what we found is that you're more efficient with your eyes than your ears, which is very common. However, what's unusual is that you're hearing with your dominant right ear, and you should be more efficient on your dominant side than your left side, which is the subdominant side. So that means you're basically what we call a mixed dominant genius, and I'm serious. You can do lots of things, and you're very versatile. But again, if you had to go be a PhD, it would be difficult. You would lose interest because it wasn't any fun. And so now you're doing videos, and you're doing those types of things, and it's a perfect fit for you, and you'd like to do it, and I think you're probably fantastic. In fact, I know you're fantastic because you did Celine's video, and it's stunning, and it's the first video we have on our website.
Good.
So we have a little plastic model of a spine here, so I can show Trey what's going on so he can understand. You're laying like this on your back. This is the base of your skull here, and then you have 7 cervical vertebrae that are purple, 12 thoracic vertebrae with your 12 ribs that are blue, and the 5 lumbars in the lower back. This has an example of a bulging disc that has a little red spot there of the disc bulging, causing back pain, the #1 cause of pain in the world. 1.7 billion people. They generally, because they don't know any different, go to their medical doctor, and pretty soon they're on oxycodone. We have the biggest heroin addiction in the world from back pain at this point, and that's what Body Best Doctors is all about. is to tell people there's a complete different way that's safe and works better. That's simple. So again, we start, it's really easy at first, so everybody's comfortable, but it gets harder and harder and harder. Okay, here we go. 379.
379.
6147.
6147.
29538.
29538.
416932.
41695352.
Okay. So he's five. It's called a visual digit span. We start off with low numbers, basically 3 numbers in sequence on a card, and I'll have Trey look at it for approximately 2 to 3 seconds. I'll take the card away, and he just simply tells me what was on the card. Then we go to 4 digits, 5 digits, 6 digits, 7 digits. We go as far as he goes, and that's how many he can look, how many digits he can look at and remember, and it's a significant thing. So here we go. This is the first card, so I'm going to show it to you for 3 seconds. You're not going to read it to me. You're going to wait till I take the card down, and you tell me what was on the card. Here we go. Okay. Go ahead.
528.
Okay.
7143. 73152. 310752. 31569.
Okay, so he's 6.